Hello, hello, good afternoon, good morning to everybody. Thank you for joining us for today's Facebook Live. We're just started. We want to go ahead and give everybody a moment to come in. So hang tight with us. We're going to make sure that we got the stream going and all the links that you guys will need. Feel free, if you're watching this, to share the video so that other folks can watch this. It will be recorded here and left on our Facebook Live page. So you guys will be able to come back at any time to rewatch this and get some of the resources and links that we're going to mention. All right, perfect. We do want to encourage everybody that is watching today to use the chat box function so that if you have any questions for our two guests today, that we're able to actually handle them live today. Feel free, you can always leave questions afterwards. And then we'll make sure to go back and address anything that you guys have around programs and service offerings from the Center for African American Health, along with our advocacy program, which we'll highlight here with our guest, Jeff Campbell, today. A reminder also that all of our videos for these Facebook Lives are also available on our YouTube channel, which we have a link dropping in the chat box here. All right, without further delay, let's get started. So again, good afternoon and welcome to another Facebook Live and Lunch and Learn from the Center for African American Health. Reminder that Colorado Gives Day is approaching. That's going to be Tuesday, December 7th, and it's just around the corner. Your gift on December 7th will make a huge difference. Every gift made on Colorado Gives Day will receive a boost of additional funding. Help us achieve our vision of an African American community healthy in mind, body, and spirit. Give where you live. Details will be available in the chat. And again, as we wait for more folks to join, I'd like to introduce myself and tell you a little bit about the Center for African American Health. My name is Eric. I'm the Director of Advocacy at the Center for African American Health. For those of you who may not be familiar with our work, we have been in the community for more than 20 years with a focus and commitment to improving the health and well-being of the African American community. As we move through today's session, please feel free to type your questions in the comment area and we'll address them if time permits. To set up the context of this meeting, we're going to address our new advocacy program at the center here called BeHeard Colorado. But I want to start back with how it all started with a current project in which it grew from called BeHeard Mile High. BeHeard Mile High is an online research panel of community members. We have 1,200 community members that are involved in giving us the on-the-ground experiences of community members, the issues, the barriers, the topics that are important to them regarding health, well-being, and community cohesion. When BeHeard Mile High started back in 2017, and it really was out of response of something that was conducted by the center. It was in 2011, we conducted a survey of the health status of churchgoers, working with a variety of different Black churches, partners in the Denver metro area. And with those findings, we were able to get 2,000 responses, which if you guys are familiar with the data gaps that we have around understanding our community's needs, that is something that has always been a persistent problem, is having robust data that is representative of our communities here in Colorado in general, but of the Metro Denver area. And BeHeard Mile High was a project that was created to be a solution to that. We wanted to understand the health status and the issues of community members in the Black Metro Denver area, and also to be able to amplify their voices to policymakers, other community-based organizations, faith-based organizations, and make sure that that's something that can be shared and can be used to be advocated on when it comes to changing the landscape and the outcomes that we experience as a community. Today, that project still stands. We use it in a variety of different ways on different topics such as transportation, education. We talk about stressors like racism and discrimination, gentrification, things around healthcare experiences, and most notably COVID-19 since the pandemic began last year. And the data is used to help inform ourselves when it comes to our programs and services, as well as our community partners state agencies, and really just to talk to community directly about what we're hearing from them and continue to engage them in a way in which they are owning the data, they're owning the process in which we learn and change the environment together. And this will segue into a project called BeHeard Colorado. BeHeard Mile High really has evolved from being more of a research project into more of a community-led advocacy and capacity building part of our work. So I'd like to segue to our first presenter today regarding that. And really, I won't even say presenter, we're really, with John and Jeff here, we're having a conversation about some of the work we're doing in the center. So I want to start with Jeff Campbell. He is the current program facilitator of BeHeard Colorado. He's also the founder and executive director of the Emancipation Theater Company. Jeff, thank you for being with us today. Could you please tell us a little bit more about your work alongside community?
Thank you so much, Eric, and to the Center for African American Health for having me here today. It's an honor to be here to speak directly to the folks about this important work in this important program. Emancipation Theater Company is, you know, our mission is gathering the community to share stories and inspire action. So beyond just having fun doing theater and programming and improv and stuff like that, we also, you know, really hope that it touches you in such a way that it moves you into action. So when the folks at the Center for African American Health asked me to help facilitate this new program, I jumped right on board because it was just in such great alignment of who we are and what we do. Just last year, we launched a program under Emancipation Theater Company called From Allies to Abolitionists, where we used storytelling to inspire folks to get involved in advocacy work. And we worked on a couple of different campaigns. One was with the Justice for Rivero campaign. Rivero Stinnett was a young African-American artist who was injured at Union Station. And we stood up to RTD and we stood up to Allied Universal Security Services, and we got him the necessary settlement that he needed for his permanent brain damage. And we also got the Allied Universal Security Company's contract canceled, and RTD created an oversight committee to ensure that safety and security was priority one for their passengers. After that, we launched the Message to the Mayor campaign, which was about people experiencing homelessness in the encampments while they're being swept during COVID-19. So we addressed that issue and lobbied for the city auditor to audit these traumatic displacements, these sweeps of these encampments. They are now doing so. And we also did a report and a people's audit ourselves that determined that the city spending twice as much money on sweeping people as it would cost to do housing. So I'm saying all of this to say is that advocacy works. And that's why this program I'm so excited about.
Thank you, Jeff. You know, and I appreciate it. And it goes to show, I think in particular, your background, you have a way of creatively engaging community, making them part of the work. And really, I'm seeing how much they need the work. And, you know, you have the right tools and expertise behind that. So we're glad to have you as a facilitator for this program, because that's the kind of, I would say, maybe spice that some of these leadership advocacy programs tend to not have. They get very dry and academic about how to engage in different civic engagement processes and how to do grassroots organizing. So very glad about that. One thing I'll mention about the program is, you know, there is the technical aspect of BeHeard Colorado, where you of course get the knowledge and you get the tools when it comes to understanding how to work in a governed way with other folks on certain issues. And an issue can be something that you define as the issue. It's not something that others will guide for you. It's got to be important to you and to the folks that you're working alongside. You get the information, you get knowledge around how to address talking to policymakers, how to work with other community members on identifying your priorities and what actions you can take to actually affect change. In particular, particularly our program, we're very interested in affecting the health equity policies in Colorado. Again, knowing that health equity is a variety of health shows up in a variety of different ways, not just within the healthcare systems. So Jeff, tell us a little bit more about why this program is necessary.
Absolutely. Well, yeah, you really touched on a lot of it. This program is very vital to the future of our community, because we can't ignore the contrasts, the disparities, the marginalization. We can't ignore the health gap. We can't ignore the disparity in the mortality rate. We can't ignore environmental racism or the root causes that are the impact that have that have an impact on our quality of life. These things have to be addressed, and many of us in the community feel powerless and as if we can't make that impact. And so, giving money, of course, we appreciate, monetary donations and stuff, but advocacy is about speaking truth to power. Advocacy is about stepping up, and folks, this program is designed to give people the power to do that, the power to speak truth to power, to engage with their civic leaders, to legislators, and affect policy that inhibits our access to quality health care. And also just to dig deep into what folks go through within the curriculum itself. We show folks how to be heard. Eric, we teach you, what coalition building is, what community mobilizing techniques. And we utilize the power of storytelling, and we use the power of community-based participatory research so that folks can get involved. Yes, the research is out there. Yes, the data is out there, but actually going through and collecting the data yourself is a transformative mechanism that once you're equipped with the knowledge of the disparities and what's happening and how to navigate the resources that are available, why they are working, why they are not working, where the gaps are, that learning process empowers you to step up and to engage your community in the dialogue and in that work. So it's vital to activate that engagement. So
yeah, well said. We've been working on the beginning of this project. Really started, I believe it was if not late 2019 at the beginning of 2020, which of course COVID changed a lot about how we are conducting this work. Last summer we actually did a health priorities survey and asked community members what are some of the policy issues outside of healthcare that they're most concerned with and what they would like to see done, as well as things specifically within health and healthcare policy. And again, that was just dipping our toes into how do we make sure that we're learning from community, we're using that research in a way to design a curriculum and a process in which community members can go through this, they get the skills and knowledge, expertise, and the practice by doing these kind of work together during the curriculum and also afterwards. One thing, I'll note that I love about what you said about these takeaways is that, you develop a relationship with the folks in the cohort, and you also have a network in which you can tap into afterwards. We don't want folks to be able to learn how to do something, be passionate, and they're already passionate, interested on certain issues, and then feel like they don't have the continuing support. And that's something that we want to do going further than what we originally planned with this program, which was create a curriculum that allows people to take power into their own hands and share that voice out and affect change. We wanted to make sure that we can continue supporting them through a network. And that's something that is another takeaway I would mention is vital to folks actually being able to get this work done, make it sustainable, making sure that it's something that they can continue doing for years to come on whatever it is that needs to be done for community. It doesn't have to necessarily be something that the center has to be funded to do, or we have to lead people. We want folks to be able to do that for themselves wherever they are in Colorado. So thank you, Jeff. I appreciate that. Looking at time, want to make sure we can switch over to another program facilitator. Works with our great guy, works with our outreach and community navigation team, Johnn Young. John, I just want to say, we are living in unprecedented times. People are struggling, and the Center for African American Health wants to be a support. Before we cover some of the services we offer around mental stress and behavioral health, John, can you please tell us a little more about some of the utility assistance programs that we offer?
Yes, Eric. Currently, we are working with Energy Outreach Colorado, and we have partnered with them to provide help with utilities. Unfortunately, because of the overwhelming response from the community, the money for the first quarter has been used, but we will be coming up on the second quarter in January, if not before, and be able to help people with their Excel or public service bill. And the best way to stay tuned as to what's going on is by going to our websites and checking, because occasionally we will get funding from the state or the federal government to help people with life things, but it is not always a guarantee. For example, some of the agencies like Mile High United Way or Catholic Charities or Salvation Army may have larger buckets of money than we do. So they may be someplace somebody else can go to for help. But we definitely have our hands on the pulse of everything. So if someone needs it, and we currently are not offering it, I do know where they can outreach to.
Yeah, thank you, John. I think that's one thing that highlight that the center has done extremely well in over the last year, particularly around COVID response, is being more equipped to address the needs and some of the referral practices that community is asking for. So variety of different things that we're offering now that we haven't historically done. Historically, the center has focused mainly on community health programs such as diabetes prevention, healthy lifestyle, healthy cooking classes, and our demographics has changed. We've always worked for the most part with the church communities and continue to this day, but usually the older population, 50 plus, will be our main audience. And now we've been able to stretch out and serve a variety of different community members across age groups, across different statuses of life. So thank you, John, for summing that up. I think that's something that has always been a need, and there's not one place that's a go or one shop stop, but the center wants to be able to fill in any gaps that we see and that our referral partners can't necessarily provide at the time that a person needs it. I do want to go into mental behavioral health, but John, do we have anything regarding maybe food security that you wanted to highlight?
There are food pantries out there, and there are churches, and there are institutions that are helping people who may be going through food insecurities. The challenge is people aren't really aware of where they are or what's going on with them. So we make it a point to be able to address that and to help people understand and navigate that. Because one thing that I know in Denver, Colorado, is if there's nothing else, there may not be housing, but there's definitely food. I mean, if you travel through the Park Hill area on any given Saturday or Sunday, churches are giving out food. If you go by Mental Health Corporation of Denver, they're giving out food today, this afternoon. So there are places and there are organizations that you can get food. And especially since we're coming up on the holiday season, there'll be places that will be giving out food all over the place. But we have to get through November and December because people eat more than just 2 days out of the year. But they are out there and they are made available. You just have to know. Jeff said it perfectly. It's knowledge and action equal power. People may be lacking the knowledge, but they have the action to call, they have the action to show up, they have the action to ask their neighbors and stuff. Put that with knowledge and you'll actually absolutely have power. Unfortunately, right now, because everybody is stressed out because of COVID and a lot of things, we tend not to come from a place of strength. We tend to come from a place of fear. And when you're in fear, you don't operate your best. It's just a given. Stress tends to make you stupid. I hate to say it, but stress will do that. And you won't operate to your best ability. So once we can take care of your basic needs and you can kind of get back in alignment and center and stuff, then it's easier to make decisions. It's easier to figure out what you need. It's easier to go to the places. And, I just want to put out there, our community is going through some stuff. We have people who say they have the blues and they've had blues for years. And we have some people who are just not able to handle some of the things that are happening. There is mental health out there. We need to make that normal part of the conversation, just like we make, talking about everything, normal parts of conversation. There's nothing wrong with talking to a therapist. There's nothing wrong with talking to your minister or your church group. And there's nothing wrong with prayer. And sometimes when you pray, God brings you a therapist. He just does. But know that it is all for your highest good and the good of your neighbors and the good of the community.
See, I appreciate you bringing that in. I mean, you found a great way to connect to them, the underlying stress that, not just COVID, but just of a lot of the things that we've had to deal with, particularly as a community, systematic pressures and even just interpersonal ones as well. And thank you for touching on, those varying degrees of mental health, emergencies and crisis and different states of being. One thing I'll say, this is a call to action. We don't want folks to suffer in silence when the available resources are available. And there's ones that live right in the same household as yours. We have to start talking more openly about our struggles. And like John said, not to be ashamed to ask for help. It does take courage to talk about these things. Particularly, we do have a stigma around talking about mental health and mental wellness in our community. We want to let people know where they can find more information. So John, who should they call or email to talk about some of the services? And, you can feel free to highlight, I know we have in particular 2 different services that we provide in the space of mental wellness.
Yeah, I mean, you can get information from our website. You definitely can get information from Facebook Live. And right now, if someone needs to talk to a counselor or something, we can refer them to the Mental Health Collaborative of Color and get them signed up for 20 visits if they live within the Metro Denver. And they also take insurance. And you can get someone who looks like you, because a lot of times we want to talk to someone, but they may not look like us. They may not have our same experience. But if you go onto our website and you use the email there or the phone number, we can get you hooked up to somebody who can talk to you and help you kind of work through some things. Also, there's other avenues out there. So if it turns out that doesn't fit for you, at least reach out and talk to someone so that maybe we can help you move into the right places. I mean, if it's an emergency, if you're bleeding, if you're hurting, if you can't breathe, call 911. We all know that. If it's a concern or a crisis or something that, you're stable, but you're just stressed out, you can give us a call and we can connect you to someone who can maybe talk you through whatever is going on. But it is not a one-time fix. It's not like I'm going to talk to you and I'm done. You may need to talk to someone for a little while. You may need to get outside. You may need to breathe. There's a lot out there, and it's not always a pill and that's it. Sometimes it might be a pill. Sometimes it might be prayer. It may be all of it. But don't suffer in silence. And don't die from embarrassment. Talk to someone. Knowledge and action equal power.
Yeah, well said, John. I know that we're coming up to time here. Just want to mention, to everybody out there, next week, many are across the nation are celebrating the Thanksgiving holiday. Do want to highlight, of course, regardless of how you feel or perspective around that particular holidays and the historical significance, we understand that the holiday season overall represents a time of unity, charity, and reflection. And something I think would be a good way to kind of send off at the end of this meeting is for us, everybody on the call here, to offer, some words of encouragement, perhaps even share a time where they had to ask for help or something that they're thankful for. I can start off, I think in particular, when I think about what I'm thankful for is the drawing breath I have every day. A lot of folks have not made it to this part of the year yet because they unfortunately passed, and that's been on the rise during COVID in particular, and all the other different health threats that in particular our community has faced just in daily life. So one thing I'm very thankful for is the fact that I'm still here standing, and knowing that no matter what kind of trouble or needs I have in the future, that I can always find support, and I can always have that strength to continue through. And I would say make sure that you return that on to others. Share that strength with others. Share yourself with others. Be authentic and genuine about where you are in life, and offer a space for other people to do that too. I think as a community, we'll do a lot better, and as society at large, we'll do a lot better if we practice that more. And I can pass it to Jeff. How about you? Anything you want to share? Any encouragement you want to have for folks during the holiday season here?
Sure, Eric, thank you. Yes, I will just echo a lot of your sentiments. I'm just grateful for the fresh air and the sunshine and every waking moment, and that I still have time above ground to do something to impact my community, to stand up and to advocate for a better world. And we're looking for leaders. We're looking for folks who want to do the same. And there's no room for fear or self-doubt. You don't have to have a PhD in any sort of health practice or anything like that. If you've just navigated your own health crisis or experience, you have that leadership within you to share your story, to inspire others, and to inspire legislators and policymakers to make change. So that's what I'm grateful for.
Thank you for sharing. How about you, John?
I'm going to suggest something people can do. Get a jar, a large jar, like a jar that had pickles or something in it. And today, start writing down 3 or 4 things that you are grateful for. Write those 3 or 4 things down, cut the papers into strips, put them in a large jar. And then over time, you'll collect everything that you've been grateful for. Reach into that large jar when you're feeling kind of down and out or disconnected, or you need words of encouragement. Pull out that piece of paper and look at it. On this date and time, I was grateful for what? I was grateful for a glass of water. I was grateful for what Jeff said. I was grateful that my feet hit the floor and I stood up. Take that and collect this. And then when you pull it out, these will be words of encouragement, things that you are appreciative of, things that will get you to the next moment that you created, that you brought in, that were part of your being. Didn't come from anybody else, came from you. That's what I'm going to suggest as a takeaway from this discussion. I am complete.
Well said. Thank you, fellas. I think those are great suggestions. I think reflection is something that is just, I think, a natural part of the journey we call life. And it works for you if you make it work. So it pays to be more thoughtful about how we're being and how we show up in our lives for ourselves and for others. So, I'm very glad. I think the holiday season emphasizes that a lot for a lot of folks. We are out of time. It is 12:30. I do want to thank you guys for everybody for joining us today. Hope you have a great weekend. Before we actually close out, I do want to make some announcements and reminders for what we got going on the rest of the year here, and also what we'll be starting up at the beginning of next year, 2022. As a reminder, anybody who's looking to get their first or second Pfizer, Moderna vaccine or booster shot or a flu shot, we are hosting a vaccine clinic next Tuesday, November 23rd from 5 to 8 p.m. That is going to be at our office at the Center for African American Health. We're in the Park Hill neighborhood. We'll put the information in the chat regarding that. We are, feel free, you can go to our website, caahealth.org, for more information. About the vaccines, we've been doing the clinics for a while. We are doing them all with flu shots now. They're available for anybody age 18 and older. They're free. There's no requirements around ID, immigration status, or insurance. Just a reminder, if you're coming in to get your second or a booster shot, please remember to bring your vaccination card so we can make sure to add to that. Walk-ins are welcome. If you would like to register ahead of time, go to our website, or you can call Yolanda Gautier. She's our Director of Programs at 303-355-3423 at extension 121. Finally, some other programs at the center that we do have this year and starting next year. This year, we still have an ongoing program. It's the Aging Mastery Program. It's a health and wellness lifestyle program that deals into the physical, mental, and the spiritual for those 50 years and older. We do have also another cohort starting within our workforce readiness program. If you remember, our last Facebook Live was on that program. So if you missed that, please catch it. Our next cohort on that program will start on December 6th. You'll learn a lot about the practical skills around finding a job, going through the interview process, resumes, presentation, planning a career trajectory for yourself. So a lot of great information. We have a great facilitator for that program. And also some newer programs that we have. We have our, this is for our men and fathers out there. We have some newer programs such as our fatherhood program. It's called 24/7 Dads. And we do have a new program starting in January called the Barbershop Talks. Keep in mind, you won't get your hair cut at this one, but you'll have conversations that that you do in the barbershop as well. So that particular program will start on January 18th, 2022. It's going to be held monthly on the third Tuesday from 5:30 to 7:30 p.m. In person at the center. This program is in partnership with Families Forward Resource Center. They have been a valuable partner. In particular, they're a great one when it comes to providing family child-based services to folks in Northeast Denver and in North Aurora, but all are welcome. So feel free to contact them as well. With this particular program, we're going to have a lot of good discussions around effective parenting, about having healthy relationships, how do we advocate better for our families, about our own health as men, social issues, and even sports. So we're going to make sure that it's something that we can enjoy, and a lot of the good incentives around that program. More details will come and be on our website. Also, speaking of our website, visit that for all the details and registrations on these amazing programs. This video, along with other information on the center, will be on our YouTube channel. We are hoping everybody has a great, safe, healthy, fun time during the holidays. Thank you for attending today's broadcast, and I want to say special thanks to our two guests today. Everybody, please take care. Be safe out there.